This is an introduction to the 3 planes of motion. We use these planes of motion to observe and identify movement. So the first plane in the body that we'll talk about is the sagittal plane. And the 2 joint actions that we're going to see in the sagittal plane are flexion and extension. We're primarily going to see this in the shoulders and the hip today as an example. This is an idea of flexion. It's happening in front of the body when we're going overhead. And also extension, which is a movement backwards behind the body in the shoulder. An example at the hip is going to be hip flexion, which is when the knee or thigh comes closer to the chest. And then also extension. So if we turn to the side, we can see the hip moving behind the body. Okay, so these are 2 examples of flexion and extension, the primary joint actions that happen in the sagittal plane. The second plane of motion that we use is the frontal plane. And the 2 joint actions that we see here in the frontal plane are going to be abduction and adduction. A quick little helpful hint to think about when we think abduction, when we think about we're being abducted, so it's moving away from the midline. So this is an example of shoulder abduction or abduction. His arms are moving away from the center of his body. As he pulls his hands back down against his body, that's the example of adduction. In the lower body, we see this in the hip with hip abduction or abduction. His hip is moving away from his center line. And when he comes back down or even crosses the midline, that's an example of hip adduction. The helpful hint there is we're adding to the body, right? Or we're pulling into the body. So adduction, pulling in, abduction, moving away from the center line. The third plane of motion is going to be the transverse plane. And this is a rotary type plane where rotation occurs. So in the upper body, we can see this as the rib cage or trunk actually rotates. We can actually see this in the shoulder with movements like external rotation and internal rotation. We see this rotation happen in the hips and the shoulders. In the lower body, we have external rotation, which means the joint is rotating away from the center line, and also internal rotation, where the hip rotates in towards the center line. So these are the 3 planes of motion that are commonly used when discussing biomechanics, anatomy, coaching, and observing movement.